The problem of counterfeit medicines has steadily grown over the past decade, fueled in part by the internet. As a public health expert, how big do you think this threat is, and what are the risks for the population?
Falsified medical products. I prefer that term because that's what we're talking about. They intend to be something that they are not. It's a very wide problem. Your risk, if you order your medicines via internet, is very large because organized crime is behind it most of the time. So internet is not your thing, should not be your thing most of the time. If you go to a neighborhood where they sell medication from the back of a car, from the trunk, don't. Your risk is very good, great. If you go to a sports establishment or a sex shop and have your pills there, anabolic steroids and things like that, great chances you run a risk. But there are more. If you are the manager of a hospital and you have a budget, and the budget is not enough to your mind, and you look around and you see a cheap wholesale dealer, don't. Risks are great that you buy falsified medicines, not the controlled stuff.
What kind of other drugs or medical products are concerned by falsification?
Well, the whole range of pharmaceuticals, the well-known Viagra, but it's for heart problems, for cancer, for diabetes, for you name it, and there is money to be made. Because in some countries, medicines are expensive, or the internet offers them at lower and sometimes at higher prices, and people buy them. So it's the whole gamut of medication, unfortunately. It's either expensive medication that's in small quantities, like Avastin, intravenous medication, very expensive, so there's money to be made, or it's large-scale medicines, which are not necessarily very expensive, but you can still make money because of the volume. Medicines on the one hand, medical devices on the other hand. Medical devices is a very wide term, but condoms, pregnancy tests, diabetes tests, and sometimes even bigger things, syringes or medical suture might not be sterile if you buy it from other sources than the official sources. So what is the risk you run? It's partly in your own hands. But where you can run these risks, it's very big.
In your view, are there countries which are more concerned than others?
Well, the countries, internet is an open market, it's a global market. And the countries, why would you go to internet? Well, if you don't dare to go to your general practitioner to ask for the Viagra, you buy it in the internet, or you're afraid, or you think you can have a financial gain, or so countries that do not have a good system of control. France is a country, Western Europe, EU countries, all have very big controls, and EU lately closed the last loopholes in the system where dealers could go in between. For medical devices, it's a well-regulated system. If there are countries that are not well-regulated, that's an open game for the players. Still, internet being open, you click a website, you can do that from as well as France or the UK or Germany or Holland or whatever, you can have it. And if you make that mistake, it's your own risk.
The Council of Europe adopted a convention on the counterfeiting of medical products in 2011.
Yes.
How do you think this convention can help governments to fight falsification?
I was stunned. I'm a simple legal officer in the Ministry of Health when I was still working. I was stunned by the fact what the route of the medication would be. They would be fabricated in country A, transported to country B, then imported there, then shipped to country C, in a bank in country D and E, and a bill to be sent from country F. Now, you are a French lawyer working here, or a French policeman, or a French customs. How are you going to do that if you do not know the people in the other countries? And that's what you have the convention for. The convention says each country should have a telephone number which another country can call. So they can cooperate, exchange data, and catch the organized crime.
Finally, what would you recommend to people who are going to the internet to buy medicines?
Not do it unless you're absolutely sure that your site is safe and you follow the legislation of your country. Again, I haven't said it yet, but organized crime is, as the name it says, is organized. If the states, the nations among themselves are not organized, guess who will win? The organized crime. And that's what we have to combat, and that's why we need a convention to do it together.